Queensland Health is embarking on a significant programme of change. We've chosen our vision to be at the forefront of that programme of change. To make that happen, we need highly talented, highly committed individuals who will deliver of their best on a day-to-day basis.
Located on the Tropic of Capricorn at the southern gateway to Australia's Great Barrier Reef, Central Queensland Hospital and Health Service enables employees to enjoy enviable lifestyle in the heart of Queensland. A government-funded affiliate of Queensland Health, we provide primary and critical care services to almost 250,000 people across a region almost half the size of the United Kingdom. Rockhampton Hospital provides the central hub for services, supported by major hospitals in Gladstone and Emerald that integrate with smaller hospitals, multi-purpose health services and outpatient clinics to form a regional and rural service network. Our vision: to change lives for the better. The geographic constraints, population and health profile presents unique challenges for the health service delivery. Investing in people underpins our strategic solutions, and ensuing transformation provides continual clinical and leadership growth opportunities.
I trained in New Zealand as an anaesthetist, and towards the end of my training I came to Rockhampton for 6 months, and my wife and family had a great time, and I had a great time in the hospital.
My wife always wanted to come over to Australia because she has spent in her youth over a year in Australia and always wanting to come back.
I was in a rut in my job in New Zealand and I was looking for a new challenge, so we decided it was an opportune time for my husband with his contract.
One of the reasons I came to a regional centre was because I'm a dual trained specialist. I'm both an intensive care specialist and an anaesthetist, and that's fantastic for my career development. I do feel like I'm a resource to the hospital because I'm able to wear a number of hats.
I used to be a trainer in laparoscopy, so that was one of the reasons why I think they attracted me.
There's a lot of great camaraderie between departments here. So the intensive care department, the anaesthetic department work very well together. There's a very supportive network, which you don't see in big hospitals. You've got a chance to establish those very personal relationships with everybody.
Most people who work in operating theatres tend to be pretty much of a family that looks after itself anyway. We have great nursing staff. We are very multicultural. We have people from all corners of the globe in our department.
I find the work very satisfying, and working in a regional area means that there's lots of opportunities to develop interests professionally.
I will be working in 2 hospitals, Rockhampton Base Hospital and Gladstone Base Hospital, and there was a huge need for a new surgeon in Gladstone Base Hospital. A smaller hospital, but a nice environment as well. A city that's growing with a young population.
I'm a Part 1 examiner with the College of Anaesthetists, and we have a very, very good success rate for our trainees from here.
We do have to deal with a lot of very difficult cases clinically. It's great for keeping your skills up that you pick up as a trainee, because you get exposure to lots of trauma, you get exposure to lots of very sick patients.
So we're looking to invest in our staff, to empower our staff to do what they're good at.
We have new theatres opening with new machines and new monitoring in the next month. They're built. We're in the unwrapping Christmas stage of it at the moment, so that's really cool.
The advantage of working in Emerald is that you're excited to come to work every day because of the diversity in what can occur. You're not only dealing with minor coughs and colds, but also major trauma, emergency caesareans and difficult psych patients as well.
It's an outreach sort of area. It brings in people from all different walks of life, from far away, and also the local community. So we see all kinds of things, which is great. Every month there's a lecture basis where we get some fly-in surgeons or obstetricians. So it's a place where you can keep your skills up.
Emerald has a diverse range of clinicians that work here that have previous experiences from their past roles. It comes in handy in education and supporting each other. We've got a director at the moment who's got previous orthopaedic experience, working as a registrar for several years. That's come in handy in regards to his clinical teaching and our education.
The linkages between the hospital and the primary healthcare arrangements is important too, and that doesn't happen in the city. The hospitals tend to be just hospitals and they don't link as well with the community services. So I found that a great experience, and it's great for the patient because we have holistic care and we're able to transition the patient from the community to the hospital and vice versa.
It's a very outdoors life in Central Queensland. That's something that I've recognised coming from the UK and something that we're really enjoying.
I have 3 children and they're sporty, they're reasonably bright, but it's a hidden thing about Rockhampton is that the school system is excellent.
Here, life is a bit easier, easygoing, more easygoing, and that's something that we like.
I live in Yeppoon, which is about half an hour drive from Rockhampton. It's on a lovely stretch of coastline, and I find that when I have my weekends off, I don't want to go anywhere else. I've got Keppel Island, 10 k's off the coast, that's got some of the best snorkelling and scuba diving in the world.
There's a lot of specialists at the same stage of life as my family, and we've got a great social network. We just love the outdoors, going to the beach and swimming, and the weather is amazingly conducive to that.
We have time for the family and we have time to go to the sports things, and the weather's always good.
Work, family balance is better here in Australia than it is in Belgium. Actually even thinking about buying a house here, so I think that's a good sign, isn't it?
One of those rural towns where people are excited to meet new faces, and we've just been lapped up into the community, which is great, and we're running a few little friend circles which have been really wonderful for me being on maternity leave.
You certainly don't feel like you're in a rat race like you do in Sydney. You've got a lot more time on your hands than you do in spending 2 hours a day in traffic.
It's certainly been a great experience for me and my family to be here in Emerald. Now that I'm responsible for 10 hospitals, I get to travel across the whole of Central Queensland, and they're great places to live and work.
People go out of their way to help you to settle in to this particular area, and there's quite a strong collegiate feel around the organisation.
To find out how you can change your life for the better, visit www.cq.health.qld.gov.au/jobs or connect to us via LinkedIn.